My experience working with Starkey has been a very long journey, I'd say. From the training parts, they usually give several trainings on the software and how to program the hearing aids. I would say the teachings and the trainings are very effective. Also, in terms of the hearing aids themselves, the hearing aids are quite effective, comfortable to the patient, and also easy for me to fit.
I also love working with the team from Starkey. Their turnaround is quite good. Their customer support is also very good. We have had a nice experience for the last 1 year that I've been fitting the hearing aids. We have no complaints, and also all our concerns have always been addressed in good time. So that has been an excellent experience for our team at Capital ENT in regards to our working relationship with Starkey.
Starkey is going beyond what just hearing aids can do, and it is really good that the space they're in and the space they're putting us and helping us to grow as audiologists, and helping me to be able to grow and giving me material to be able to learn, information to be able to be aware of what is happening in the hearing industry.
At Starkey, and compared to the income in the countryside, they have a range of products that will meet the pocket needs of those patients that will need their services, but they are based in the countryside. At least I can get a product that I can take to the far end of Kakamega, and I will get a child who will use it, and the family will give me the feedback. Because this is the only way we can say we are providing services to mankind, reaching out to the underserved areas in the country.
What I love about Starkey is the Starkey team. They're supportive, easily available, and friendly.
Dennis Tunya is my name. I'm the head of education and training here at Starkey in Africa. I am sure we have interacted to nearly all of you in a sphere or the other. We still reiterate our commitment to making sure that you are able to serve your patient better than anyone else. So in order to do that, we are bringing to you the art of customized hearing solution. And of course, at the heart of this is the big boss, who is the ear. It's good to know that somebody might have 2 ears, but of course, every ear singles itself out. Every ear has its own audiological needs. So we are having a conversation where we are shedding a spotlight on every particular ear, and considering that every patient that comes to sit in front of you is not just an amount of money that has walked into your clinic. It's a particular need that needs to be addressed. So we are talking about patient centric care. And today, at the heart of it all is Starkey. And of course, with Starkey, artificial intelligence and technology plays a huge role in making sure that we meet not only their audiological needs, but also the patient's wants to the patients that come to us. Since 2018, Starkey has revolutionized its hearing sort of formation and hearing production with the introduction of artificial intelligence from as far back as Livio AI days, and then we evolved into Evolve AI hearing aids, and then we brought in the beginning, the genesis of Genesis AI hearing aid, and this was the beginning of the DNN era. And then thereafter, we brought the Edge AI, and then we are just about introducing another big one in the industry, a game changer in this region. It's already been unveiled in other spheres of our business across the world, and we are just gearing towards being able to bring in the new and the best of its kind in this region. More to come. Just be patient. In the next few weeks, we will be able to know what more Starkey has for the African market. So with the advent of DNN, the deep neural network, we introduced a different type of fitting software that we call the Starkey Prophet. This is informed by the questions, the very many questions that you have asked us. It's only human that sometimes we could be confused between what software programs what kind of hearing aid. I have had questions being asked does Prophet program Evolve hearing aids? There's profit program review, just to be able to set the bar straight. Profit is just for Genesis, Edge, and the soon to be launched hearing aid. So that having been said, I just want to be able to show you how easy it is to be able to use Profit. There you go. Very easy, very simple, very time efficient. Within a duration of less than 3 minutes, you have already done it from box to best fit. You've already completed your hearing aid fitting session. And this is what the future looks like. Starkey has invested, of course, heavily in terms of making sure that whatever we give you is easy and easy for you to interact with. Of course, at the heart of it all is a professional that is using these softwares. We have taken a lot of your feedback to be able to come up with this software, to be able to make sure that the future is not only bright, but also very, very simplified for you. So when it comes to this homepage, sort of normally, oftentimes, people who have interacted with patient Profit can be able to attest. I've had questions being asked. So what does this bar do? This part that has a graph. So just as a common knowledge, just know that the blue represents the soft sounds, and then the green represents the average sounds or the medium sounds or the conversational sounds, and then of course, the black one represents the loud sounds. So whenever you're doing your patient sort of fine tuning, you're trying to give the best listening experience for your patient, make sure that you focus on using the blue, the green, and of course the black. And of course, right towards the end, this little guy here, there is a pin. You can always be able to pin to be able to follow word processes so that it's simplified for you from box to best fit, as we say. That having been said, now I am super delighted, so excited to introduce a gentleman that has served diligently in this industry for just about 25 years, customizing hearing aids. He is based at our headquarters in the US, in Minnesota. And this gentleman, of course, he is sort of enthusiastic, he's so energized, and he has taught several audiologists in the art of customizing a listening situation. At the heart of it all, please don't forget, there is the patient. So coming on board is one Mr. Ray Woodward. Hey, Mr. Ray. Mr. Ray.
Hey, how are you, Dennis?
Oh, yeah, there you are. Hey, man, how are you?
Good. Thanks for having me. I'm excited to be here.
So glad you're here, man. So I know how good you are at your job, especially how good you are at customizing hearing situations and hearing solutions for your patients. I was there at our headquarters not long ago, and I had a patient walk in, and they were just like, I don't have a problem with my hearing aid. I just came to watch Ray. I came to see Ray. That was quite a moment, man. I was like, this guy has to come. This guy has to teach us. So I am so delighted that you could create time. I know it's very early in the US right now, and it's very cold. So, man, feel very welcome, and please take the floor.
Thank you, Dennis. Hi, everyone. I'm excited I'm excited to be here. As Dennis said, I'm at the headquarters in Minnesota, and actually it's 10 degrees outside Fahrenheit, so it's really cold right now. But I want to tell you a little bit about my history of how I ended up being here at Starkey at the headquarters. Um, so back in 2000, in 1999 to 2000, I worked in a private practice. I was in private practice for about 2 years, and then I was introduced to Bill Austin, the founder of Starkey, and I came up to the factory, and they hired me, and I've been here since 2002. And I tell you, I've been very fortunate and very blessed because I've been around Bill, and a lot of you guys know who Bill Austin is. And we just had his anniversary of 65 years in the hearing industry. And so Bill started when he was 19, and now he just turned 84 yesterday, his birthday. And he's been a mentor of mine for over 23 and a half years now. And I couldn't ask for a better mentor. So I'm excited to be here because I want to give you a different perspective about customization. And I know I'm aware that, in our industry here in the US, we say about 70 to 80% of our patients are being fit with domes with the RIC. And so I work here at the headquarters, and I see about, believe it or not, we see about 230 patients a week. So we're very busy here, and we see people from all over the U.S. With difficult cases, mild losses, all across the board: surgical ears, prosthetic ears, Meniere's disease, fluctuating hearing. So we see pretty much across the board of all different types of hearing losses. And being with Bill and watching him, craft the molds to the ear. And, over the years, I've done a lot of classes on teaching about ear impressions. And I know most of you guys have shot in ear impressions. I mean, ear impressions are a common thing in the industry, but I think it's a lost art. I think we're not fitting as much customs as we should. And I'm going to go through that with you guys and show you a different perspective that I've learned. And keep in mind, coming from a private practice for 2 years and then coming here, so it's been over 25 years since I've been in the industry. So coming from a private practice to the headquarters, I've had the opportunity not only work with Bill, but his engineers and his technicians, the engineers that design the products and the technicians that build the products. So I've been exposed to so many different elements of our products that I think it will help you, give you a different perspective on how can we utilize these products to get better outcome for our patients. And you know as well as I do, the best thing we want to do is what's best for our patients. At the end of the day, we want our patients happy. And in our department, I would say 70 to 80% of fittings are custom. 20% are domes. So we're the opposite of the industry. Yeah. And the reason why is because we see better outcomes when we do a custom product to the ear. So go ahead and go to the next slide, Dennis. Okay, keep going. So if you look at Starkey is known for custom products. Bill started fitting customs back in the 70s. And so in 19, I think it was 71 and 72, the 4 shells came out. And then we started going into the ITCs, the CICs back in the 90s. And then we do what's called the custom case. Well, back in 2009, we used to call them APs, which meant absolute power. Now we call them custom case molds, which is 2009, if you see on the screen. Yeah. And in 2010, we fit the smallest hearing aids in the world. They were IICs, invisible in the canals. And one of the reasons why we fit those is because there's some people that don't want to wear behind the ear. And you get some of those patients that say, I don't want behind the ear. And they don't care if they don't have Bluetooth or accessibility stuff. So they want something kind of hidden. Mm-hmm. And so the IIC, we fit a lot of celebrities and VIPs that come see Bill. And when they get in front of the camera, they don't want people to see the hearing aid. So the IICs was started in 2009. So it's been around for a while. And that's part of the Signature Series. So we do have the Signature Series of custom products, and that's one of them. And so the IIC, actually, I wear one. This is mine. Yeah. Yeah. And it's one of my favorite ones I wear. And so 2010, in 2020, we came out with the first rechargeable Bluetooth ITC. And I tell you, when the pandemic hit in 2019, 2020, we fed a lot of those. And the reason why is because people, when they're wearing RICs, a mask, would flip them off. Yeah. So we started getting into the custom more. And that's why I learned a lot about the ITC rechargeables. And then we get into 2022, we were the first CIC Bluetooth hearing aid with the 312 battery. And that was back in 2022. And then 2023, we came out with the RIC with the custom case with the Genesis. And then 2024, we came out with the CIC rechargeable. We were the first, but it's not Bluetooth, but it's wireless where you can connect it to the computer. And then 2026, what he just mentioned, that's coming out, the Omega. So this is, the reason why I wanted to show this, Dennis, is because I wanted people to see the kind of the history. Now, when it comes to making custom products, you know as well as I do, we have to shoot the impression. Yep. Right? Yeah. And one time I did a class and there was like 500 people in the classroom. And I said, what do you guys use to place the block in the ear? And I would say about 60% of the class use foam. And about 40% use cotton when they place the block. Well, I prefer cotton. Yeah. And the reason why I prefer cotton is because cotton, you can make it flat and you can go down further in the ear and it's less abrasive. And if you get the right diameter and you get it flat enough, you can give us a good length. So I'm a cotton advocate. And, if you look at the foams, I can show you guys just real quick. So here's some foams that I wanted to show you. These foams right here, they're kind of big. You see the size of those? And then cotton, they're kind of round. I usually number 3, and then I downsize it because cotton, there's different sizes. You have 1, 2, and 3. Yeah. And 3, I like 3 because you can flatten it, and it's not as abrasive when you get down the ear, and it stays true to the ear. When you take it out, the cotton shapes to the ear, and it doesn't go back to the foam shape. So, and it's interesting because being around Bill's a perfectionist, and he likes things just right. So the more I shot impressions, Bill wanted to make sure that he got a good impression because we know that poor impressions, poor fits. Yeah. Good impressions, good fits. Yeah. So what comes in makes a big difference on what goes out. So we found that the impression is very critical and it's the foundation of our products. So I've learned to perfect the impressions and I've been doing it for a long time. Actually, the most impressions I ever shot was probably over 110 impressions in one day. We had a lot of customers coming in and I had to shoot a lot of impressions. And we were here till 2 or 3 in the morning, making sure that our customers, and they were audiologists and hearing specialists. We had both coming in and we were training about the new technology that was coming aboard. So we had to shoot a lot of impressions in that one day to get them in class. So just to let you know, these are the 5 key points that I wanted to bring up because these are 5 very important points. Size of the cotton, the placement, the syringe tip when you put it in the ear, the waiting time, and then breaking the seal. So I just wanted to show you that real quick. Can we go to the next one, Dennis? So this right here is very common. People use what's called an otolite, and you sit down at eye level, and that's we see a common thing that we see in the industry. The next slide is what I do. I do the videotoscope. The videotoscope, and from what Dennis told me, that you guys do have the videoscopes in your offices. I like using the videotoscope because it gives me a better view on the screen, and also it has the patient participating. And I was telling Dennis, that's part of the human touch. So if, when people see you doing the work on the screen with putting the cotton in their ear, and they'll say, "Oh, that's my ear." Some people have never seen their ear before. So they find that very interesting. So you're creating a relationship. And so I tell you, again, we shoot a lot of customs in our department, and even with the RICs for the custom case molds or, the snapping receivers, but the custom case is what we mainly do. And when I shoot them and they see it on the screen, then we start a conversation like, what am I looking at? And I say, this is your ear canal. This is your eardrum. Your ear canal is a good size because we know that every ear is unique and different. And sometimes I see jaw movement when people open and close their mouth, the TMJ, And when I see that movement, they're like, "Oh, what is that?" I said, "Your canal moves quite a bit." So I think when I shoot impressions, I get engaged with the patient. So you guys know as well as I do, building relationships with the patient, they become loyal and they come see you because they feel like you're building a relationship to them as a person. I think that, shooting impressions, everybody thinks, oh, just to make a hearing aid. Well, I think it's more than that. I think it's building relationships.
Hey, Josh, how are you?
I feel like it's
Good to see you.
You know, show the video.
All right, it's okay.
Go ahead and show the video. Yeah. So Dennis, so this is the video that they put in our impression kit for people that fit our products, and this video is showing you how I shoot an ear impression with the video scope.
So what I'm going to do is, first thing I'm going to do is I'm going to take a look in your ears and make sure there's no wax or any blockage before I shoot the impression. Okay. So let's take a look in your ear real quick. Looks pretty good. So you're doing wax. Okay. So I got an idea what size your ear is. So I'm going to use this cotton. I'm going to flatten it out. Make sure I get the right circumference. It's important to flatten this because I want it to be comfortable and get the nice depth that I need to get a nice long impression. I'm going to use my curette. So I think when you start using a video otoscope, I think you should practice bringing the tragus forward and hold the camera at the bottom. And the reason why I'm saying that is because I always go from the top. So if you know where you're going in, you have a better shot at what you're doing. So always, learn how to hold the camera and then position it on the bottom, and then I go from the top. And that's the key. Going from the top gives me an idea where I'm at. If you don't go from the top, you get confused. So I think it's important to hold that camera at the bottom and keep the curette on the cotton. And I like to go around the circumference because you want a good seal. And if you notice, I twist. And when I twist, I don't have to move the whole curette. I can just twist and it goes where I want it to go. What's tricky sometimes is when you have a really curved ear, you have to pay attention to the curves because you don't want to hit the ear canal. So I got it positioned where I want it. And if you notice, when you go in deeper, it gets tighter. And what that does is it gives you a good seal so you won't get a blow by. And this is a good spot. So here's the first bend. Here's the second bend. So I'm past the second bend and actually very close to the eardrum. We're actually on the eardrum. So I'm going to shoot the impression now. I'm going to brace the head and stick the tip in. And it's important to stick the tip past the aperture. And then when you shoot it, let it flow out naturally. And then go up here, down into the concha bowl, up into the helix. And sometimes I like to go up in the triangular fossa. And come back down and stay in the center. Then we'll wait about 5 to 8 minutes to remove it. It's important how you remove this because, as you know, when you shoot an ear impression, you create a vacuum. And when you really take out the impression, it's so important to pull on the ear to break the seal. And then I'll show you the technique that I use to remove it. Yeah. So I'm going to check. The good way to check is with your fingernail. Make sure there's no indentation. So it's nice and hard. So it's ready to be pulled out. Again, I wait 5 to 8 minutes. So the key with this is when you shoot an ear impression, before you remove it, you should always pull the ear back like this and down. Make sure. And sometimes you can tell them to open and close the mouth. And that helps break the seal as well. So I always do this with all my patients when I remove the impression because we know that it creates a vacuum. And then what I do is I pull from the top and I twist it towards the nose, nice and slow. Okay? Nice and slow. And then I grab the string and I pull it gently. And there it is. This is how you want it done. You got a good length. There's no voids. I got everything I want to build any model of hearing aid. And then I like to take a look in the ear again to make sure there's no leftover material or so forth. It looks great. Everything looks good.
Absolutely amazing. So this is really good, Ray. Just a quick recap. You have clearly mentioned that when it comes to patient-centric care, putting the patient at the heart of the care, making them participate. For instance, what we've just witnessed, the patient is able to see exactly what you're doing. Nothing is hidden under the carpet. They are able to follow from the beginning to the end of exactly what you're doing. And this is something that I'd love to implore to other professionals at our clinic, to be able to make sure that at least let's keep the patient informed of whatever you're doing. Oftentimes, as professionals, some of us get tempted to draw back into being professionals and forget that we are dealing with a human being who needs to know. They just need to be updated for the sake of comfort, being able to create a rapport so that they can be able to open up to you, so that you can be able to even give better solution in terms of whatever they have come to be able to find. So something that you have mentioned that is very good, very critical, you have clearly mentioned that if we are customizing hearing aids, we are customizing the hearing aids, we are making a custom cased receiver, we are customizing molds, we ought to take good impression. Just like you've clearly said, garbage in, garbage out. So I implore my fellow professionals, whenever you are seeking to be able to get that utmost comfort in terms of fitting, the perfect fit, endeavor to take good impressions. Just like Ray has mentioned, a good impression always has those two, the first band and the second band. There are no sort of gaps and all that. And above all and beyond, make sure that the patient is comfortable in everything that you're doing. So feel free to interact with us, ladies and gentlemen. We would also love to hear from you. There's a chat box over there. Please text us your questions, text us and engage with us so that we can be able to move as one cordial team that is patient-centric. So over to you, Ray.
Thank you. So if you look at this, here's an example of a foam and I see these yellow tips here in the US quite a bit. And if you go to the next slide, click on the next one. And what we do is we remove the foam, go to the next one and do it again. So look at the difference when you remove it. When you go back, Dennis, when you remove the block, we lose a lot of length. And what happens is if you order something like a CIC or something smaller in the ear, the foam takes up too much space. And we found that if you use a cotton and flatten it, you'll get more length on the canal. So everything I'm telling you is just those little details that we have to pay attention to because, being here at the factory, this is what I see that comes in. If you look at this first one, this was an order. Click again. This is an order for a full shell, and this is a custom case in a CIC. With the full shell order, you see all those wrinkles? We can't have that if you want a full shell because what happens is you get a poor fit. The custom case, you see all those, we don't like to see all those wrinkles, those voids. And the CIC, they used a foam block and we lost length of the canal. So I just wanted to show you some of the things that we see that come here. And this is an ear impression that my point with this is you see how the picture on the right, on my left, the ear canal goes upward. The other ear goes straight. So these are two different patients. And I just want to show you the difference, why it's important to get a good length because it tells us where the eardrum is. And so we can point the receiver in the right direction. Now, this is a good topic. I want to really talk about this because, if you look at the domes are, I think domes are great. I think they're good to use, obviously, because a lot of people do use them and we fit them a lot. But I tell you, we have, when you have an opportunity to get some people in better technology, and let's say they're wearing domes and you want to improve their experience, you may consider a custom case or snap-in receiver. And the reason why I'm saying that is because believe it or not, 9 out of 10 people that we upgrade, they never go back to a dome. They stay with the custom. And here's the reasons why that we see this. One is they stay in better. So you can get better retention on a custom mold than a dome sometimes, depending on the ear. The sound quality, you can get better sound with the custom, and you get better sound direction to the eardrum. The third thing is, and a lot of people don't talk about this, but I'm going to bring it up because it made a difference for our patients. When some people say, well, I'm on the phone and I'm streaming, I hear too much background noise, or there's too much noise coming in. A dome allows the noise to go through the loud noise. If you make a custom mode, it helps block some of that noise out. So when they're streaming, it sounds better and it gives it better fidelity. And also, when you make a custom, the background has to go through the technology because you're blocking the sound out of the ear. So we found that when you go from a dome to a custom mold, you get a better experience. And like I just said earlier, 9 out of 10 times when we upgrade from a dome to a custom with the newer technology, they don't want to go back to a dome. And you know as well as I do, the domes, sometimes they don't fit, even if you change them. Sometimes they don't stay in, they irritate their ears, and they always have to push it in, or they say, when I push it in, I hear better. So I see these things and I know what you guys go through and I totally get it. So I just want to let you guys know to be aware that if you start learning more about customs, you may get better outcomes in a patient that has a dome. Now, I do want to say one more thing, Dennis. If you have someone that comes into your office, and we know we want to give them best hearing as soon as possible, and you want them to leave with the product. Yeah. If you have someone and their hearing loss is down in the lows, and they need a double dome to get a good seal to bring up the amplification for the hearing loss, I would shoot their impression before they leave. I'll say, listen, we're going to get you in these domes. Go ahead and head out and let me know how it goes. And by the way, do you mind if I shoot your impression? So when you come back, let's see how you're doing. And if they say, I wish it was louder, or they're not saying, you have the impression. So sometimes what we do is we shoot their ear impressions, even though when they leave with the domes in their ears, when they come back, we're ready. And so I think that's a good tool to use in the offices because you're building a relationship with them. You're understanding their ear. So I just wanted to bring that up. So these are custom case modes that I actually modified myself. I created these. Being at the factory, I'm able to cut the shells for our patients on site because I'm at the factory. And so if you look at these are custom case molds. And this is right before they put the receiver in there to embed it, to snap it to the RIC. And so the first one is with a canal lock. And then the one to the right is kind of like a half shell. And the reason why I did that is because they had dexterity issues. They couldn't hold the dome in their ear. The dome was hard to get in and they couldn't hold it. So I made a custom case mold where they can put their finger in the bowl so it'll be easier to handle. So they can get it in and out easier. And also the canal locks really help retain it. If they have a lot of TMJ and the canal is moving and it's walking out, even with the domes, if the domes are coming out, and you try several different sizes and it's still coming out, you can do a canal lock on a custom case mold and it retains it really well. So when it comes to custom case, it's an art. You got to figure out what's best for the ear. And Dennis knows this as well as I do. The ear is the boss. Yeah. The ear dictates what we can and cannot build. So we always talk about how do we fit the loss? Well, we also have to say what's best for that ear for that loss. So we have to interface. If you look at technology is evolving. It's amazing how fast we're going with technology. It's very impressive how advanced we've gotten. We know the technology is there, but we can't lose the art and craftsmanship of understanding the ear and how we interface it to the technology. So if it's not comfortable and it's not staying in, they're not going to wear it, no matter how good the technology is. So I wanted to bring that up because I think it's important to look at other options if you need to. Yes. Now this slide, I get a lot of questions about this slide. I've been showing this slide for the last 20 years in my classes. And a lot of people say, how do you know what size vent to use? Or what receiver should you use as far as to the loss? And my personal, I've learned this with Bill. Bill taught me this. The thing is when it comes to a custom case mold that you see on the left, the receiver, the way it's embedded, if you look at the venting on the left, where it says 500 to 750, the frequencies right there for venting, we look at the lower frequencies for venting. So the better the lows, the bigger the vent. That's why we fit a lot of domes, because we see a lot of people with normal lows, and we don't want the patients to feel occluded. And it's a moderate loss. So yeah, we can fit that because you don't want the occlusion effect. Well, I found, I just want to bring this up, with the newer technology we have today, we're finding that we're having people have less occlusion issues with our custom fittings. So we can get away with a smaller vent now. But saying that, so if you look at the graph on the left, that's the guideline that we use at the Center for Excellence where I work. And that's how I determine the vent size. And then on the right, you see 2000 hertz. 2,000 hertz is a pivotal point. It's very critical for speech. And it takes more energy to turn up the 2,000 frequency. So if you look at 2,000, the further it goes down, the more power we use in the receiver. We also look at the MCL, the UCL, and what they wore in the past. A lot of people, I'm surprised that, when I talk to these groups in classes with audiologists and hearing specialists, I always tell them, look at the history. If they're a power junkie and they like it loud and they have a 70 receiver in there, if you go to a smaller receiver, they might not like it because they're used to the volume and the power of that receiver. So I like to gauge off what they wore in the past. If they were a dome and you want to try custom, make sure you get a big vent because they're used to an open fit. So and also if it has a canal lock or if it's a half shell or whatever it may be, you can learn from that when you upgrade them to newer technology. So this is a great guideline to use. It's not for everybody, but it's the average that we see that works very successful. And if you look on the far right, the receivers. Can you go back next?
Yeah, sure.
On the far right, if you look at all those receivers, the 40 receiver all the way down to the woofer. And people ask me, say, well, how can you get more power out of a RIC than you can in a BTE? I get that question a lot. So here's the thing that I found. And I'm going to tell you this, and I'm going to share it with you guys. In our department, we don't fit BTEs. We don't. We fit RICs. And the question is, how do you fit a RIC on a profound loss? We do it all the time. And the reason why we can do it is because we embed the receiver inside the canal and we make it closer to the eardrum. When you embed that receiver closer to the eardrum, the sound pressure level goes up. So you don't have to turn it as loud. A BTE, the receiver is behind the ear. It has to travel through the tube, through the mold. So we found that you can fit a profound loss with a RIC, with a very strong receiver embedded in the mold that is inside the canal. So we found that you can get more power, you can get less feedback because the receiver and microphone are separated. In a BTE, the receiver is inside the case with the microphone. But when you take that receiver out and put it inside the mold, you're separating it. And guess what? It becomes more stable. So we found that when you separate the micro receiver, you put the receiver in a solid shell inside the ear canal, it gets louder. And guess what? When it gets louder by physics, you don't have to turn the hearing aid up as much because the receiver is right there inside the ear canal. So we found that we're able to fit more losses. And that's why we call it custom case, because back in 2009, 2010, when we call them absolute powers, they were made just for profound losses, severe to profound. Now we call it custom case because you can fit pretty much any loss with it if the ear allows it. Again, the ear is the boss.
Yeah. So, Ray, while you're there, because I know there's a menace, there's a big number of audiologists in this region that fit BTEs. Just because looking at the history of the patients that we serve, oftentimes our people they're laid back. Until recently, they used to be very laid back when it comes to admitting that they have hearing losses. So by the time they're coming to the clinic, it's probably at the level of severe to profound, oftentimes at around 7 years of struggle with hearing reduction. So we realize that oftentimes we tend to fit BTEs. My main concern, and this would probably be a question from the rest of the audiologists, some of them.
Yes.
How do you handle pediatric fittings, especially when it comes to RICs?
To come to what?
RICs. How do you fit children with RICs?
Yeah, fit profound losses with RICs. Yes.
And children. Do you fit children, pediatrics?
Oh, kid. No, we don't. We don't fit a lot of pediatrics in our department. No, we fit mostly adults. Yeah, okay. We do see some pediatrics, but I tell you, when we do see pediatrics, we fit them with RICs. Do you know why? Because I'll tell you, because some kids don't like big BTEs behind their ears. They want something small like an MRIC. So we put them with an MRIC, and if they get older, the ear canal gets bigger, so we remake the mold, which is fine. But we do with some kids, we do fit RICs because they're nice, they're better looking, and we want them. I have parents tell me they don't want to wear them at school because people are looking at them; they're very noticeable. So if you can do a nice MRIC, with a nice thin tube with the custom mold, it works. It does well. But yes, I see what you're saying. But yes, sometimes we do fit Wicks on kids. We do.
Okay. And that it's also informed by the fact that you are able to customize the solution right there while the patient is seated right there. Unlike this side of the world where sometimes they have to wait, the impression has to come to us from probably a country in West Africa, and then it has to go for being remade and remodeled.
But when you make an ear, Dennis, so when you make an ear mold for a BTE versus a Rick custom case, is there a time difference in getting it back?
Yeah, just a little bit of a wait time, a time for you to be able to wait. Turnaround time. There's a bit of a turnaround time because being the facility that supports the continent, we support the far and wide across the region. So sometimes it could wait. It could have people wait a day to a week, depending on whatever they are working on. But either way, we try our best to make sure that we don't keep the patients waiting. So far, so very good. And I think unless we have any questions, if they are, I will probably check, but we can go on while we get them ready.
Okay, thank you. Okay, so this is a unique ear. This ear is actually a prosthetic ear. A lot of people in my class, when I ask them, what is this? They'd say they don't see anything wrong. So if you go to the next slide.
Okay.
So this is when you take the ear off. And I don't know if you guys see a lot of prosthetic ears, but I've seen quite a few. And one of the tricky things about prosthetic ears that I found is feedback. And the reason why is because the ear is not part of the skin of the head. So you get slip leaks around the prosthetic ear. So what I found was sometimes I get 3M tape, which is a adhesive on both sides. And I put it on the prosthetic ear with this is a magnetic snap-on. And when you need a really good seal between the ear and the head of the patient. So just keep in mind when you work with prosthetic ears and the person needs a lot of power, it's a little tricky when it comes to getting a good seal from the ear to the head. If it's a mild hearing loss moderate and you don't have to push the hearing aid as hard, you won't get as much feedback issues. So when you shoot a prosthetic ear, the first thing you should always do is make sure that the silicone doesn't stick to the ear. Prosthetic ears are made out of silicone. And I had a counselor call me from a different state saying, hey, we can't get the impressions separated from the ear. And the reason why is because the silicone of our impressions and the ear are similar, so they're adhesive. And guess what? A prosthetic ear costs between $8,000 to $9,000. And so we don't want to damage those ears. So what we found was if you put oil on the ear, and the material that you're using, you want to test it and see if it sticks to it or not after you put oil on it. So if you put oil on the prosthetic ear, the silicone won't stick to it. Or you can use what's called powder and liquid. That's what we have in our department. And when you use powder and liquid, it's not adhesive at all to the ear. So keep in mind when you shoot an impression of a prosthetic ear, it has to be on the head, and the whole of the prosthetic ear has to line up to the whole of the head to get that good sound direction. So go to the next slide, Dennis. So I worked on this ear, and you can go all the way through it. Yeah. So what I did was I shot the impression on the patient's head, and I took it out. And when you shoot the impression, it flares. When it flares, it gets stuck. So I had to get a razor and cut it out to be able to get the impression out. And then I modified the impression to where it goes into the prosthetic ear very well. And then I tried it on the patient's ear. And again, this is powder and liquid, so it doesn't stick to the ear. You can use silicone, but you got to put oil on the ear to prevent it from being adhesive to the ear. I've done quite a few prosthetic ears. I've seen patients that have what's called Treacher's Collins, and those ears are typically deformed or they have a prosthetic ear. So that's I've worked on a few prosthetic ears, but the tricky part is if the hearing loss is more profound, you have to get a good seal. This right here is PMJ. We get a lot of discussions about jaw movement, and I'm going to tell you, there's people that say, "Hey, you should use a mouth block." There's some people that say, "Well, I never use a mouth block." So you have this belief. Everybody has this different theory of how we should shoot impressions on someone that has a lot of jaw movement. So what I say is shoot it with a relaxed jaw. If you do an open mouth impression, what happens? The canal gets bigger. When you do a closed mouth, the canal gets a little smaller. The impression changes. And then when you do a tight, like you see these three differences, those are basically based on how they're moving their mouth. If you do an open mouth with a block in their mouth, it's going to make the fit tighter. Okay. It's going to make the canal bigger. See, it says open jaw on the first one. And then the second one, when you close your jaw, you create a gap. And then the third one, if you tighten down, it creates a bigger gap. Now, what's cool about this image is the TMJ usually occurs on before the second bend on the anterior wall. So if you get somebody that says, hey, I hear clicking, it's because the canal is touching the dome or the bud or a custom mold. So what I would do is, and this is a trick, and you guys might want to know do this. So if you look at our receivers, they're different lengths. If you look at a 40 receiver, a 50 receiver, and a 60 receiver, when you put those domes on, the 60 receiver is a little longer. So we found that if you have someone that says, I hear clicking or my molds are walking out, it could be two things. The jaw is moving and it's pushing on your dome and it's making the dome come out. The 60 receiver goes in further. So the 60 receiver can touch that area where the jaw is moving. If you change it to a 50 receiver, you may get away from that jaw movement. So just remember those receiver lanes can affect how it sits in that ear. And so if you have someone that you tried every receiver and every dome and it's still not staying in the ear, it's time to do a custom mold. So I think that if you have issues with the domes, you have another option. And this is a good example. Okay. So this guy, I worked with this guy and he had a lot of jaw movement. If you look at the front side of his ear, the tragus area, it was removed surgically. So you can really see the jaw movement in this ear. Go ahead and click the video. There's a video on. Can you click it? There you go. You see that movement? That's TMJ. And in this case, the TMJ seemed like it's more out of the ear, but since he had surgery, that's why it seemed like it's more out. But usually the TMJ is deeper in the ear. What we did was we had to make a custom mold and we had to seal the whole opening of that canal. And because when he opened and closed his mouth, it created a big gap and he had a lot of feedback. So what we did was we shot the ear and we made a full shell and we filled out the whole thing. And right where that jaw moves, we made sure there was a good seal there. And it was great. Now, the reason why I wanted to show you guys this is because, again, I do a lot of fittings like you guys do in this facility. And if you look at the right ear, and that ear is a good dome. It's a good bud fit. But that left ear, as the high side can put it here, that happens.
Ray, I think,
High
Mr. Ray,
only.
we are losing you. Can you hear me, Mr. Ray?
Hear you?
Yeah, can you hear me? There was a bit of.
Yes, I can hear you.
All right, go.
Can you hear me okay?
Yes, I can hear you now.
So the right ear, you know, you see how it's doing a precipitous loss. You can do a good dome on that ear. But the left ear, I would think about a custom case because you can drive the highs harder with the custom case with less feedback. So in this example, if you're going to do a custom case on the left, might as well do a custom case on the right, but make sure it's a really big opening. The MCO is only 60, the UCO is 100, and really good word to scrim. So this person, and we see a lot of these because this guy was he was a hunter, and his left ear, when you shoot a gun, the left ear was exposed, so his left ear was worse than his right. But we did a custom case on him and kept the vent really big, so because the lows are normal, so we make sure he didn't have any occlusion, and it stayed in good fit. But the reason why I'm bringing this up is because the further the loss goes, I think we should consider custom molds. Now look at this one. Click it again. Okay. You got to go back.
Yeah, right there.
Okay. You see this loss? We see them a lot here. We see a lot of profound losses here. In this case, the MCO is 110. The UCO is 110 plus. So this guy, he's pretty much, profound hearing loss. And we fed a lot of RICs with the custom case mold with a very strong receiver embedded in that image. And we're able to reach those losses. and make it loud enough for them. Now, I want to bring this up because, you know, I do fittings like you guys do. Anytime you fit profound losses, go to NLR. I like the more linear settings because if you make it more linear, it sounds louder and richer. So we found that if we put with profound losses, we like to keep it more linear and keep it more the power they need. I think our proprietary ESAT is amazing. We use it all the time. ESAT is really a good formula that we have that it's really good for those mild to moderate hearing losses. But when you get into those profound losses, that people that worn hearing aids for many years, or they wore analog hearing aids and they're used to analog sound, you should go to NLR and you can do a BTE, but we do the RICs with an embedded receiver. And we fit these, and it works out very well.
Okay.
Oh, another thing before I forget.
Yeah.
So, can you go back, Dennis? There's one more thing I want to say. So, if you look at this, I remember fitting this guy. I fit the mold. We fit the fitting. We verified the fit. You know, we have relay and we do a functional gang, and we do the verification. And we found that with people with profound losses, I didn't look at his previous hearing aid, and he didn't like what we did. He didn't like the way it sounded. He's like, and he got the new technology and it sounded great. And he's like, you know, there's something wrong. My voice, I don't like the way this sounds. And he had a profound hearing loss. Mm-hmm. His old hearing aid had a pressure vent in it. His new hearing aid, I didn't put a pressure vent in it. Mm-hmm. And you could tell a difference. Mm-hmm. He's like, I don't like the way these sound, my voice. So I put a pressure vent in it, and guess what? It solved the problem. Mm-hmm. So sometimes you have to look at the history because the history tells you what they're used to. So anytime you see profound losses, look at what they've worn and look at that vent. You know, I've taught a lot of classes on fittings, and a lot of people don't talk about venting on custom hearing aids and the matrix. And I think that's just as important as the technology. So I will keep teaching this stuff because I feel like Bill's always told me that how we interface the hearing aid to the technology is just as critical as the technology. Because we know that if we fit the hearing aid just right and they love and it looks good on the graph and you did everything you did that was perfect for the patient, but you didn't put a vent in it. And they're like, I don't like the way this sounds. So they think it's the technology, but it was just a vent that made that patient not like it. So I put a pressure vent in it, like I said, and it solved the problem. And then we have other people that had a big vent on their old hearing aid that was a custom. Mm-hmm. And I went to a smaller vent and the hearing loss didn't change from previous. And they hated it because they're used to an open fit. So I've learned a lot with the previous hearing aids they've worn. If they have a canal lock, it lets me know that they had retention issues. So when I get the new hearing aid, I'll make sure that I do something similar to that, the new one, so they won't have retention issues.
Yeah.
Yep.
This is amazing, man. So a few things I've picked up. Patient history, just being able to know whatever the patient has been wearing previously plays an integral role in being able to find a solution for them. And then, of course, you've mentioned about null R for patients who prefer power fittings. So this is but perhaps a technique that I would implore that the rest of the team could perhaps try in the next couple of days. If a patient comes, they have a profound loss. Of course, we adore our ESAT, but there is an option of the NALR, the linear sort of processing, to be able to make sure that the patient can be able to get more power. As Ray has said, we can try. Let's just endeavor to try.
Another thing, Dennis, I'm glad you brought that up. Another thing I noticed was the previous ear mold was the canal was long. So when you get a new one, make sure the canal is long, because when you make the canal shorter on the new one and the old one was longer, it changes the sound, the loudness of it. So when I see an old hearing aid with a long canal and they've been wearing it for 5-6 years, the new one, I'm going to ask for a long canal because they're used to that long canal. I've done it where I make a new mold and I made it too short and they keep pushing it in like, this is not fitting like my old one. I don't like the way this feels. And I'm not hearing as well. Yeah. And so what I did was I remade it again and made the same length as his old one, the canal, the mold. And it was like, so when you do BTEs with ear molds, look at the old one to see what they've worn to give you an idea of what they're used to. So when you order the new one, you want the similarity of what that fit was, because it makes a difference. It does.
That is amazing, man. This actually informed some of the complaints you've heard. I've heard some clinicians be like, I fitted. You guys say that age AI is the best, but I fitted a patient who initially had Evolve AI, and they tend to prefer their Evolve. So the fact that the person that fitted the new Edge, but did not probably take the history of how the other sort of mood fitted or how comfortable it was, it makes now the patient to start wondering if they are even okay with the newer technology, if it's not fitted right. So that is why we insist on you being able to get it right the first time. So just like Ray has said, let's endeavor to take good history, look at the canal, just see if you can be able to compare, if then the canal lengths of the molds that you have, the custom cased receivers, to be able to make sure that whatever you're making comes just as close to be able to give a solution that the patient is used to. So that even as you supply better technology, as you supply better listening experience, there is that aspect of comfort that will make the client to be receptive of the new technology that you're trying to sell to them. Once again, ladies and gentlemen, if you have any questions, we are going to have a brief session towards the tail end of this, which is now verified. To be able to attend to some of those questions, please keep them coming, and we shall continue. Over to you, Ray.
So I'm glad you brought that up, Dennis. That's very important. This quote, I read this quote many years ago, and it really resonated for me because, you know, the more I shot ear impressions, the more I fit custom hearing aids. I believe we are what we repeatedly do. Excellence then is not an act, but a habit. So I've learned that the more you shoot impressions, the more you order customs, the more you're going to get better at it because you're going to understand more about how they fit. And, shooting impressions, as many as I have, I try to perfect it every time. And I'm to this day, I'm still trying to be better. So I want to bring up to you guys that what you repeatedly do, make it a habit and do the best you can. And I tell you, when I train people, Dennis, on how to shoot impressions in my classes, there's some people that are very good at using a video otoscope to place the block. But there's other people that are not as comfortable because they can't look away from the ear and look at the screen while they're doing it. And then I have other people that use an odorlight to place the block. And they're better than the people that use a video otoscope. So it's not about what's like I showed earlier about using a video otoscope versus an odorlight versus the video. It's what you feel comfortable with and how many and your experience with it. So you can get a really good outcome just by using an odorlight with the block, or you can use a video otoscope with the video I showed you. So I think the more I've shot in ear impressions, the more I understand the ear and the more I understand the techniques to get better. So, and that's how I want to end this, is because to me, it's about repetition. In anything I've done here at the factory, as far as, modifying. Oh, another thing, I have to bring this up.
Yeah.
So let's say, before I forget, let's say that the hearing aid is walking out, and you get a new order, and the hearing aid is not staying in. If you shoot the impression, you can look at that impression and see where there's retention areas. And I wish I had a slide on this, and then what you can do is know how to modify that to get it to stay in better based off of the ear impression to see it, so you don't have to send it back to get it remade. So sometimes we do things, I do things personally, where I know where to add material on the hearing aid to give it better retention because I looked at the ear impression. The ear impression tells me where the retention is. So typically, if you have an ear impression, if you look at the front wall where the second bend is going, the front wall of the ear, where the second bend is, I typically, when I modify molds a lot, because again, I'm here at the headquarters, I have access to this, but if you take off on the front side of the ear impression, right, that's for insertion of hearing aids. The back side of the impression is for retention. So since I know that, when I get the hearing aid and I feel like not enough was taken off on the front side, I take off a little more on the front side because the patient's having a hard time getting it in. If it's easy to get in, but it's not staying in, I know the back side is for retention. So I add material on the back side that lets me know that I can help it retain in the ear. So as many ears I've seen, I've learned through Bill and the technicians where to add and leave off. But so if we ever do another course in the future, Dennis, I can talk about how I modify the molds to get them to work better without sending it back in.
Great, man. I look forward to such and more conversations. I am particularly fascinated by this. If we are what we repeatedly do, excellence then is not an act but a habit. And this is not because probably, of course, Ray is exposed to this fancy video otoscope, and probably perhaps in your clinic you don't have those kind of high-tech video otoscopes. But with whatever you have, if you do it, if you
Yes.
in a tradition of making sure that you do it right every other time, it now becomes a habit. It does not become something that happens once in a while. And you don't have.
Hey, Dennis, do they have otoscans?
No, not so very many people. Most of the time we have handheld otoscopes in this region, and a couple of people have Delphinos for the video otoscopes and other types of video otoscopes, miniature video otoscopes. But the advanced styles of video otoscopes, like the one that you have, is not very common in this region. I think so far I have seen them in like 2 centers, one of course being our own in our recently launched